My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back for this edition of the Heavily Meddled Podcast. Today, we've got an episode that is going to hit really hard and leave you thinking. We are diving into a story that has not been told on this podcast before, so I'm super excited. This is a story about stents and more. Our guest is Shannon, and she's been on a life-altering journey after receiving the wrong stents that she was actually allergic to, despite making her nickel allergy clear to her medical providers. Her story is one of resilience and advocacy, and she, like all of us, hopes for better informed consent in medical procedures. Welcome, Shannon.
Thank you very much for having me, Sherry. I appreciate it.
Now, where are you from? I think you're a Texas girl, but are you in Texas now?
Yes, I am. I live in the Rio Grande Valley area, so I am in South Texas.
Okay, great. And why don't you just tell us a little bit about who you are, where you're from, what are some of your passions and hobbies outside of dealing with health issues?
I originally was born and raised in Ontario, Canada, and I moved to the United States when I was 16. And I lived in Michigan for well over 20 years. And in 2023, I relocated to South Texas. So I've been here ever since. I really love the arts. I'm an artist, and I also love to write. So those are my passions. Those are things that really help me through. They help me cope and express my feelings through this medical journey. I've been doing art since I was a child, and I really love it. I love to draw and paint traditionally. And more recently, I've learned digital painting. I've broken into using my iPad, and I really love using my iPad because I can use it if I'm laying down, propped up on the couch. So it's a wonderful tool. It's very accommodating to my disability issues, but it's just incredible what I can do on it. So it's really
awesome.
And I highly recommend it to anyone if they're able to get an iPad. It's the most wonderful tool you can have if you're dealing with medical issues, and it's just fantastic. So I've been doing that. I enjoy small nature walks. I love nature. I love to photograph flowers. I also love to draw and paint them, which I always say I like to draw and paint, but I love to draw and paint. I live with my mom, and we have one home. We each have our own separate apartment space, so I'm close to family. I live in a 55 and over community, but they let me in legally through my mom. And
nice.
It's really interesting here because I have many surrogate grandmothers and grandfathers, aunts and uncles all of a sudden. It's really great. And this past holiday was amazing. I feel a lot of love in this community. They understand medical issues because, of course, they're older adults. So they're very patient with me. And I've really full circle socially because when I lived in Michigan, it was very isolated. It was like a cold wasteland.
Yeah.
Northern Michigan is beautiful in the summers, but the winters are treacherous. And I was always so isolated. So for the first time in my life, I have a social life. I'm living normally. And
awesome. And you're looking fly. Tell me about this beautiful scarf you're wearing.
Thank you. It has zebras on it. And the zebra animal is the mascot for the rare disease community. Now, I got this at a thrift store in Houston area. This was maybe about a year ago. So I love it. But as far as rare diseases, I have a perfect trifecta. And we call it the trifecta. Those of us that have these conditions, we know it. It's hypermobile Ehlers-Danlos syndrome, mast cell activation syndrome, or MCAS, and POTS, or postural orthostatic tachycardia syndrome. And I have all three. Yes, and Sherry's raising her hand. That's
And metal
very
allergies. So it's more than a trifecta. And then you and I share another medical condition that you can disclose if you want. But yeah, it's more than a trifecta.
It's more than that. The trifecta is just the small part of it. I don't know if years ago people remember, but there was the licensed game known as Zelda, an old Nintendo game.
Oh, I remember Zelda.
Triforce, the Triforce, right? I jokingly refer to my Triforce as being those three main conditions. It's been quite an adventure. And so I'm just wearing this scarf in solidarity with us rare disease patients. Now, I don't think I could run like a zebra. I don't know how the zebra was chosen. I can't, I couldn't run like one, but they're unique and they're one of a kind. And that's how we are. And we have to see ourselves, though, as more than just our illnesses. We have to see our strengths, too. I think when you're dealing with chronic illness, like what we have, it starts to wear you down. So when you asked me about my interests, that's very important that we recognize what we can do in light of what we're not able to do. We have to recognize what our strengths. And
people were surprised when I was sick. I would lay in bed or on the couch and I was in bed 23 hours a day, but I worked on my computer, and some of my best years working as a real estate agent were because I was able to just lay there with their computer. And Facebook brings us together. It brought you and I together. It brings a lot of people together. The Facebook communities are wonderful. And honestly, I've made lifelong friends, and a lot of my recovery I owe to some of these Facebook groups. So it's very important to stay connected for your mental health.
Yes, it is. And I think of even my artistic creations. If I wouldn't have been shut in and holed up with illness, I wouldn't have the portfolio I have. I would have nothing. It would just still be in my head, which I spent a lot of time alone in solitude, but it was a gift to me because like you said, all the distractions are blocked out. So it's just me, myself, my sketchbook or iPad. And I was able to really learn the skills I needed to learn. On my terms, which is so important for us with disabilities.
Kudos to you for keeping your mind active and all of that.
To the beat of our own drum. That's what we learn to do with rare disease.
Got it.
We have to learn to live that way. And
for sure. Let's move into talking about your story, because you have something called May Thurner syndrome, and that's not a widely known condition. Can you walk us through how you were diagnosed and what your initial reaction was, and then how we got here to you connecting with me?
Okay. Persons with Ehlers-Danlos syndrome, they are susceptible to vascular compression syndromes. And May Thurner syndrome is a vascular compression syndrome, and it's when the iliac vein is compressed by the iliac artery. So what happens is this vein gets compressed, and it's responsible.
Let me stop you for just a second. For people who aren't medical and don't know, that are just tuning in, where is the iliac vein?
The iliac vein is in the lower abdomen and pelvic area. So it's parallel. The junction between the iliac vein where it goes up into the superior vena cava, that's parallel to the navel area. So it's lower abdomen area. And so that vein, it goes down the length of the leg. But the main areas that are compressed in the case of May Thurner is in the area from the navel about to just where the thigh area begins.
Okay.
And affects most people on the left side. It's a left-sided issue. Rarely it affects the right side, but in most people, it's the left leg, and it mostly affects women. It can affect males, but it typically affects females.
Does it cause pain?
Absolutely, it does. It causes pelvic pain. It causes bloating, constipation, leg swelling. Rarely it can cause blood clots. It can be very serious. In some cases, if there's a blood clot and it breaks off, it can cause a pulmonary embolism, which can be fatal. Typically, it presents in younger women. A lot of times, if women are taking oral contraceptives, it can trigger the formation of a clot. So in many cases, it is seen in younger women who are taking birth control pills. I was not taking birth control pills when mine was discovered. I never had a blood clot. So I went many years with leg swelling and pain, and it was never diagnosed. They would do an ultrasound, they would do blood work, they wouldn't see anything. So it wasn't until 2023 that where I was formally diagnosed. So I went probably at least 10 years with symptoms. I remember I would go to the ER with my leg swelling. They would do an ultrasound, do a D-dimer blood test. Nothing would show. You're normal. Here's pain medication. Go home. So that was my life for many years. It was horrible. It can be painful to sit. The blood pools with this because of the compression. There's blood pooling. So that pooling irritates adjacent nerves. It causes pain, swelling. It can mimic all kinds of things. It can mimic spinal problems. It can mimic gynecological problems. And it's just miserable.
Now, let me ask you this. Did you, in the workups that had been coming back normal prior to your diagnosis, had you ever had like a Doppler on your legs to look at your other veins?
I had numerous ones. And
were they normal?
They were. And what's interesting, Sherry, is they don't go high enough. With iliac compression, they have to go high. They have to look where that junction is between the iliac vein going into the superior vena cava. So that's a vein that runs up and it's bringing blood back up toward the heart. They would use the transducer and they would look at my thigh, maybe my lower leg, because most DVTs are found in the lower part of the leg in the calf area. And that's not where the iliac vein is being compressed in May Thurner, but it can cause pooling and backup because it's like pipes, right? If a pipe is kinked or blocked in one area, it's going to affect all the pipes below it. It's going to cause a slow. And that is what happens with May Thurner syndrome. So here I am having all this leg pain. I thought maybe I had something wrong. I had multiple MRIs. I had MRIs looking for cysts, tumors, ligament, tissue, bone injuries, everything. Multiple scan after scan. It all shows normal. One scan showed edema, which ding, ding, that goes back into the lipedema. And I have lipoedema, as I've disclosed to you. And so I'm having all this pain. I'm not knowing what's causing it. I finally get referred to a vascular surgeon because I have an inkling it's May Thurner. And he orders a CTA angiogram, which is a CT scan with injected contrast, and it looks at the vascular system in better detail.
I'm going to stop you and ask, so you had an inkling that you had May Thurner before you were even diagnosed. Why?
Yes.
How did you get that inkling?
Well, I did my own research. I talked to people. I would just Google my symptoms, and I found out through the rare disease community that May Thurner affects many people with Ehlers-Danlos. So I thought, gosh, I have Ehlers-Danlos syndrome. It all ties in. I get the leg swelling. It's left side dominated. And I thought maybe this is what's going on. And plus, I also have chronic venous insufficiency. So I had that going on to begin with.
But you had a normal Doppler. How do you know you have chronic venous insufficiency?
Because May Thurner is very common in the hypermobility community. In my case, I'm going to be honest and blunt. I think it was gross misdiagnosis and medical ignorance. And I'm not putting down all doctors. There's some very caring doctors out there. But when it comes to the rare disease community, there are doctors that don't know, that are willing to learn, but then there are doctors that just don't want to. And I feel like in my case, it was all overlooked. And a CTA angiogram had to be reviewed a second time because the vascular surgeon didn't look at it. And then when a neuroradiologist looked, he saw a 75% compression of the left iliac vein. So this was 75% compression. And I was walking around like this for probably a decade.
How bad was your swelling?
I noticed it enough that when I have a shoe on, my shoe always feels tighter on my left leg and foot than the other. It always feels tighter, and socks and hosiery feels tighter.
Can it be diagnosed by an ultrasound, or is it only a CT angiogram?
Ultrasounds can, but it has to be a keen eye, the eye of the technician, and they have to go up toward the groin. They have to be looking for it. I would not have had the delayed diagnosis had there been an extra set of eyes, and that's what AI serves as. With medical technology, it's extra eyes. The treatment is not always stenting either. Sometimes they can do angioplasty and just dilate it. And sometimes they can do a surgical bypass, which it's surgery. This is going to get into why we're talking here today. Stents aren't always the option. And there are many kinds of stents with different metal. The composition differs greatly between stents. They're not all the same.
Right.
So when someone says they have a stent, I need to know, well, what kind is it? What is it made of? Pelvic venous congestion is basically when the veins, the ovarian vein, all the veins going down into the ovaries in that area, they become pooled. They become basically backed up because the veins dilate more than normal. And that can cause pelvic pain. It can cause pudendal pain, vaginal pain, rectal pain.
So they missed it. You had the imaging. Tell me what they decided to do about it. And then how do we get to the metal allergy story?
So the first surgeon was a vascular surgeon. He reviews the imaging. He proposes putting a stent in. I ask about the stents. I say, I can't have nickel-based stents. So he proposes putting in a PALMAZ stent, PALMAZ. And those are stents that are used for coronary issues of the heart. And I found this out later when I did some searching. And I thought, I can't go to this doctor because if they put a PALMAZ stent in my iliac vein, those stents are designed for arteries. They're not designed for veins. So artery stents are more inflexible because arteries are more inflexible than veins. So I thought if this person is not familiar with treating this, I don't want to risk having the wrong kind of stent put in. They put an arterial stent in a vein. It could perforate right through the vein. They're not made for veins. So I just talked with my mom and I'm like, I'm out of there. No hard feelings. This doctor did order a compression pump for me. They did refer me to lymphedema manual therapy. I'm going to give them credit for that. However, when it came to the interventional aspect, I saw red flags and I just politely declined. And then my mother started helping me search for somebody because we live in South Texas. There's not a lot of people in this area that treat May Thurner because it's a more rare syndrome. So she found someone in the Houston area. This person claimed to have expertise. They had board certifications. My mom said, I think this might be the person to go to. They said that they could get me in right away. So I thought, okay, I'll go and give this a shot. So this is fall of 2023. And I'm having spine issues. I'm having pain at L4, L5. I have extreme degeneration. I have a broken bone called a pars defect. I'm in horrible, excruciating pain. But when I see this cardiologist, okay, they tell me that they want to wait on putting the stent in until after I have my spine fusion surgery. Because if they try to do fusion, if a person has a stent, they can risk fracturing the stent because the stent is very close to where the hardware is placed. So the doctor was right about waiting to be stented until I have the fusion, and it's been a few months and things are going well. So this is December of 2023. I don't recommend it. It was not pleasant. It was more invasive. I did heal well. I didn't have the best aftercare, but it's what it was. I had the fusion done. My incision healed beautifully. I had a rash, but it was from the chlorhexidine. It was from the surgical scrub solution, which that's part of the MCAS issue.
I react to that too.
Yeah, you get a rash, but anyway, they do the fusion. It was very painful. I'm still having some issues. I'm having problems with my sacroiliac joint. Ding, ding. That's being hypermobile. I'm having the PT. I'm seeing people to help address this issue, but back to the stent.
Do you still have your spinal hardware?
Absolutely. It is stainless steel. That's what I asked for because that was the only non-titanium, because I'm also allergic to titanium. It was low nickel, no titanium. That was the only option I had.
Okay, you can have it removed, right?
Absolutely. And I'm waiting until I'm completely fused.
Is your surgeon willing to remove it?
I don't know. However,
I had my L5S1 hardware removed.
You did? Okay.
It's as painful as the original surgery, unfortunately, because they still have to cut that back muscle. It's about a 2-week recovery, but the surgery itself is not usually too big a deal. They don't take out the cage that is where the disc was. No. They take out the supporting hardware, like the screws and the rods. Let's get back to the stent. So you came away from the guy with the Palmaz stent.
I'm 3 months out from the lumbar fusion. And I go back for my second meeting with the interventional cardiologist to place the stent. Now, an interventional cardiologist is a lot like an interventional radiologist. They can place stents and things through catheters and wires. And that's how he had apparently the qualifications to do the stenting. I go to them and I'm with my mother. She's in the room and we tell them that I have a nickel allergy and I ask what kind of stent would be used for the May Thurner. And he said a Boston Scientific wall stent, which is stainless steel. I go back to the interventional cardiologist about stenting and disclose that I have a metal allergy. And I asked them, and my mother also asked about what the stent material is made of. And we were both told it would be a stainless steel stent. So I'm like, okay, I can handle the stainless steel. And
let me stop you. You are aware that stainless steel has nickel in it, even if it's a trace amount, correct?
Yes, I am.
Okay, because that's a big breakdown with a lot of doctors and surgeons.
I can wear stainless steel jewelry, and I seem to do okay.
And let me clarify, that's probably surgical stainless that you're wearing, not just stainless.
I wear surgical stainless, yes. And this is even a year out. I've learned much more since then, right? It's interesting because when you're desperate and you're ill and you're in excruciating pain, this is something I want to emphasize with people. You cave. And it's not because you're weak. It's because you're human. You cave. You get worn down by the pain. You're worn down emotionally, spiritually, physically. You are worn right out. I go to the procedure. I have this procedure done in a cath lab. And I'm out of it because they give you all kinds of different drugs. I'm partially sedated. And I go into recovery. I'm discharged from the hospital. They give my mom the paperwork that comes with the device ID cards, and I go back to the hotel. A couple of days later, I decide to go through the paperwork. I just start going through to see the report because I don't have the brain fog. The anesthesia is getting out of my system. And I find the device cards, and I see the stent type, and I look it up. It's pure Nitinol, which is pure nickel, and titanium, which is the two metals that I'm allergic to. So I'm like crying my eyes out. My mother is in complete shock. She calls the surgeon right away. She has permission to speak with all of my medical providers, but she calls the surgeon and she's telling them, you have to do something. My daughter's allergic to this. You have to do something. She's told that you could take Benadryl and steroids. That's what we're told initially. And my mom is telling this surgeon, you have to find someone to get these stents out. She can't take them. Sherry, within a few weeks of this event, I tasted metal nonstop. It was like a constant taste of metal. Anytime I moved a lot, did any gentle kind of exercising, even physical therapy, I tasted the metal. I started having these boil-like lesions developing in my groin area, which there's a condition called hidradenitis suppurativa. And it's an autoinflammatory disorder where people, they get boils on their skin. They get it in the armpit area, the groin area. It affects the epicrine glands. And I had it previously, but it was in full remission. Within 2 weeks of this, I'm getting a complete eruption of this. I'm getting itching everywhere. I'm getting a metal taste, extreme vertigo. So bad that I'm laying in bed having these vertigo episodes, and I'm hanging onto the bed thinking I'm going to follow the bed. I'm dizzy. My POTS symptoms right through the roof. It's just unbelievable. It's unbelievable. And this person to put the stents in, the surgeon did zero follow-up. They did not contact any other surgeon that could remove these. I found out in hindsight that if I would have got in to an interventionist within the calendar month of stent placement, they possibly could have went in through my groin and removed them with a catheter, with a wire, guide wire. And now, because it's been so long, the minimally invasive option is probably not an option.
Okay, let me pause you for a second and go back. Yeah. We'll come back to talking about the minimally invasive option and what options you have at this point. But going back, you had the discussion with the surgeon about your allergies. He had committed to stainless steel. He had chosen a device that had a completely different name from a different manufacturer, correct? You chose it together because you had already looked at the composition of the implant. So you guys had a plan. When you get to surgery and you're in pre-op and you see your surgeon and you're going through things with the nurses and then the surgeon comes in and marks you, did you ever have a repeat discussion on the implants? Did you write anything in the consent? Did you initial anything in the consent? Did you do anything there to verify the implant?
They never came in. That physician never came in and talked to me before the procedure. Can you believe that? They never talked to me. Okay. I was wheeled into the room. Now, I was an anxious wreck that day. But in hindsight, I was never communicated with again about it. I do remember signing some forms prior to the procedure. I had no aftercare. I was supposed to have an ultrasound of my iliac veins approximately 3 weeks afterward to check for stent patency. There was no ultrasound ordered. When I inquired about it, I was told that they were not accurate and they didn't show anything and it was pointless to order one. It was that unbelievable. And you will not believe it, I thought I was only going to have a stent placed on the left side, which was bad. They placed 2 stents, 2 nickel titanium stents, one in each vein, my left iliac vein and my right iliac vein, and I had no symptoms on my right side. None. I was asymptomatic on my right side. Now I'm symptomatic.
So how do they even do that when you authorize a procedure on your left leg? How do they then take the liberty to do the right side as well? Does that fall under the standard of care moniker?
It does, but from what I've surmised, there really wasn't a good reason because I had no disease evidence on the right side. Even in the operative report, it said that there was no evidence of illness on my right side, but because my left side was so severe, they were going to proceed and stent my right side anyway, just as a preventative measure, which is really quite outrageous because
that should have been a discussion when you were awake.
I was out of it because they gave me a lot of controlled substances. The doctor spoke with my mother and a nurse did. The conversation was that it went well. and that I needed to make sure that I stayed on the blood thinning medication, which of course now I know as an EDS patient, those can be risky. I took it for a month and stopped because I looked like I had been run over. My legs looked like they had been run over. Even my mother looked and she was terrified. And I was okay. I didn't have any clots. I was okay with that regard. No blood clots or anything like that. But I was starting to taste metal all the time. I was having an exacerbation of my lipoedema symptoms. My legs started to swell again. They went down a bit, but then they started to swell up again, and it flared everything. And I know it's because I'm reacting to the nickel and titanium composition in the stents. I was doing much better. I was accepted to the university. I was going to start a business. I was going to do all these things. And now, Sherry, I'm lucky to get up and get through my day and have a shower and make the phone calls I need to make and do a little bit of painting. It has turned my life upside down. I've been trying to find people to help me. I have had consults with multiple providers, vascular surgeons. I have upcoming consults. I have went to doctors locally and they're scratching their head. I went to a gastroenterologist because I was having bloating and abdominal symptoms that came on, and I was having almost IBD-like symptoms. And they basically gave me a pat on the back and said, there's nothing wrong with you. We're glad you're doing okay. They said, I wouldn't get those stents removed because you probably don't want to do that. And this is a gastroenterologist.
Not even in his wheelhouse, is it?
No. And it was so smug. And I conducted myself politely. I thought, I'm not going to burn bridges, but I'm just going to politely leave. He was more interested in me having a colonoscopy than helping me get to the root of these stent problems, which can cause widespread inflammatory issues. And
he hit the easy button.
Hit the easy button. Hit the, the monkey see, monkey do. So here I am. I'm somewhere where there's hardly anyone who understands this. Now, I do have a cardiologist who's trying to help me. She's doing some research. She's trying. So I'm going to give them credit. I'm not going to throw the baby out with the bathwater, right? But at the same time, the lack of accountability, the gaslighting, the doctor who initially put the stents in has all but disappeared. And I've been basically abandoned to become a medical refugee. It's so unbelievable. But I know that my story is not unique. It's not unique, Sherry.
That's the sad thing.
That's what's so sad. There are many of us.
And look, I can tell that you don't have a psychosomatic disorder. You're absolutely brilliant. And it's a shame that we have to go without medical degrees and learn how to diagnose ourselves and become our own physicians.
We have to memorize the Merck manual.
Let me go back and ask you a couple questions. Refresh my memory. Have you had a lymphocyte transformation test or a blood test, patch test? What have you had?
I believe it was in 2022. I had the LTT blood test.
From ELISA or orthopedic analysis or both?
From orthopedic. It showed that of all the metals, I was mildly reacting to nickel and titanium.
Mildly?
Mildly.
Were you on any immunosuppressants at the time or allergy medicines or steroids?
Interesting to see what it would show now if I had it repeated.
It would be interesting to see. Have you ever done anything like the patch test or Sensiband or anything yet?
I haven't done that. I thought about trying the Sensiband because I can buy it and use it in my own home. That's why I thought about that. There's mixed reviews on patch testing, but I know that when I put in nickel-based earrings, Sherry, within about a half an hour to 45 minutes, my ears are bleeding, oozing, crusted over, and I'm getting an eruption of lesions by my ears.
I'm surprised that the test was mild.
It could have been a medication, but I don't recall being on any steroids. I thought about possibly just having a repeat, but it did a mild allergy, which that to me, that's valid.
Was it before or after they changed the reference ranges? It sounds like it was before.
It was right on the border of when they did it. So actually afterward, it would show me as non-reactive. But I had it done just on the cusp of when they switched over.
So it was probably like a 2 or a 3 down there.
Yeah, I think my nickel's around a 3.4. Nickel I reacted more to than titanium.
Interesting. Yeah, and that would make sense to me. I think it would be very hard in your position. You know what you're experiencing in your body, not downplaying that at all, but I think it would be very hard without a overwhelmingly positive blood test, possibly, to convince a vascular surgeon to remove stents that have now been in for a while.
It's hard. And I know that that's why I thought about more in-depth testing and just to see, because there are other blood tests as well. There are IgE tests. There are different tests. And patch tests, there's controversy. Some say, oh, yes, they're valid. Some say no. Now, I know this is more maybe considered anecdotal, but when I wear nickel-based earrings, that in itself, I'm thinking they're oozing, they're bleeding, they're itching. My lymph node starts to swell in my neck. And I'm thinking, if that's happening with my ears, what is going on where these stents are placed, right?
Yeah, correct. So you're going to think about a repeat test. Have you followed or do you follow a low nickel diet? And is that helping you?
I do. And Sherry, when you posted about that, what's so interesting is I follow a low food map diet, okay, to treat IBS. And a lot of the foods that are discouraged that you're supposed to refrain from are high nickel foods. And I made that connection. When I eat lentils or dark chocolate or anything high nickel, a lot of nuts, I am MCAS flaring like you wouldn't believe. So just by me doing that, it has improved my IBS symptoms. So
are you MCAS flaring or are you nickel flaring? That's what I'm wondering.
Yeah, maybe it's a little bit of both, but
or maybe it's all nickel.
Yeah, it's probably nickel. And it's really something.
And you didn't know anything about that prior to the podcast?
About the low nickel diet?
Mm-hmm.
Not really, because I know for IBS, a lot of people, they get success on a low food map diet. So I just started following that because whenever I would eat any food that was off that list, I would be very sickly. So I've had to get strict with what I eat. And I splurged a bit over the holidays, but I just made sure to up my MCAS meds to a safe amount, right? But I thought my mom made these 7-layer bars and oh goodness, just the treats.
Some friends of mine did me this favor. Cashews are my weakness, and cashews are one of the highest nickel nuts there is.
They're so good.
They roast these famous cashews and they coat them. I don't know what they coat them with, but it's like sugar and a really salty, like a really big grain salt. They're like salty and sweet cashews that are home roasted. And they gave me this bag this big. I've been eating 4 of the cashews every day and I've been able to manage to have them. But oh my gosh, it's like a nickel bomb in a bag.
I know it. It's like we have to have our creature comforts. Like I really like chocolate. I know that dark chocolate, aside from the nickel, it does have profound health benefits. But I find that if I do just regular chocolate in small amounts, okay, not too bad. It's when I go on the high amounts of the chocolate, and a lot of the chocolate products, they do have heavy metals, and then they've done media segments about that. So
they say keeping the nickel in the diet down to below 150 micrograms a day. And now a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. Melisa, a valuable diagnostic tool in medicine. Since you're new here, have you followed or heard about the Low Nickel Diet Cookbook?
Not the cookbook, but I have followed the diet, and it's probably keeping me alive because I know if I was eating a lot of the high nickel foods, I probably would be bedbound and miserable. I would be.
Well, a plug for Laura Duzette right now, thelownickeldiet.com. That cookbook is amazing. She's in her residency to become a dermatologist, and she has her own nickel allergy. And there's a meal plan. It's a hardcover book. You can get it on Amazon. Beautifully done. Laura Duzette. There's a podcast episode with her. Episode 17.
I'm definitely going to check that out because having a cookbook, that might motivate me to want to cook a little more when I'm feeling up to it because, gosh, my wonderful mom, she helps me so much. I don't know what I would do if I didn't have her. She's wonderful, but she's felt so bad through all this. She's devastated, and it's devastating, but I keep fighting the good fight. I don't quit because there are others out there who need to know the story and know that they're not alone and that there are many of us. This is a real medical problem. It needs to be taken seriously by the medical profession.
What's been the most frustrating part of the journey?
Finding a doctor that can do an intervention and help either remove these stents or possibly find a medication that could modulate the immune system, but then those medications are very high in side effects. So it's a cross between finding a surgeon willing to remove the stents in the most minimally invasive way possible, which that's going to be challenging, and then finding an immunologist or another medical doctor that will listen to me and help me with managing the MCAS, because it's all connected. It all goes hand in hand. And MCAS, that's just now gaining some acceptance. I know Dr. Efren has made a great effort in promoting, educating people the public and the medical profession about MCAS. I've read the book. I don't know if you've read Dr. Efron's book, Never Bet Against OCAM, but it's a very good read. It's a lot of medical terminology. I highly recommend it about mast cell activation. My immunologist in Michigan recommended it when I was living there.
I know a lot of us suffer with that. I'll put the link to that in the show notes if you'll make sure to send it to me. Let me go back for a minute. So is your understanding that at this point the stent can be removed, and what would they do instead?
Okay, if it can't be removed, they need to find ways to modulate my immune system and to put out the fires, to control the inflammatory response.
Sure.
If they can't remove it. Now, I know some people off-label, they use some of the biologics that are reserved for asthma and urticaria. I'm checking more into it. I know it's an immunologist and documentation. My insurance should be open to covering it. I'm open to trying new things. However, I always research the side effects if there's been any serious complaints. For removing it, of course, it's a major procedure. It's usually a bypass. And because I have one in each vein, that complicates it even more. When there's one to remove, usually it can be straightforward.
I guess the lesson here is if you're going to get an implant, and this is not the first time I've heard of going in to get one thing and coming out with another. And obviously, since tort reform, suing is not going to be the best use of your time. And unfortunately, it probably wouldn't change much anyway. What you really want is to feel better. So it just highlights the importance of, if you understand you're getting a certain implant, you have to have a surgical timeout. You have to initial that with the doctor. You have to look. You cannot trust the system. You've got to look with the nurses in pre-op. You need to see the implants with your eyes before you go under. And even then doesn't guarantee you're not going to react to a different alloy.
I understood that I would have a stainless steel stent. And of course, I woke up with a pure nickel titanium ones. I said this before, when they're scared and they're sick and in pain, they get desperate and they cave. I consider myself someone that I do my research. I give my due diligence, but I was so wore down, Sherry. I was still getting through the fusion. I was in so much pain, so tired.
You don't have a social life. So you're in seeing these medical professionals. They act sympathetic toward you. So you probably believe they're sympathetic toward you, and you want to trust. You want to hope. We've all been in that situation, I think, where our doctors and their nurses have to become our friends, and they're not technically our friends, but it's the only people. So
we need to have an ally somewhere, somehow.
Yeah.
Because it can be isolating, but there's times it can be very lonely. And of course, if you have something complex that's not really well understood, it's even more isolating. It's not like you can just go to a coffee shop and say, hey, I have EDS and MCAS and I'm allergic to nickel. Most people would be like, oh, what's that?
And I need my coffee without coconut creamer.
Yeah, exactly. It can be a very lonely journey. And then, you find a sympathetic doctor. And when I went to this one doctor, they were like, oh, honey, sweetie. And they were so warm and gentle, seemingly reassuring. And I was just like, oh, what a nice doctor. Okay. And
what do I know? But it sounds like medical malpractice to me, but who's going to do anything about it? The burden would be on you. And is that the best use of your time?
I want justice. I found out that this individual that placed these stents, it was not in the Texas Medical Board database, but they had been previously sued by another patient for maiming them. And the Texas Medical Board made no note of this. I found this out through private research. And I thought, oh my goodness, they severely maimed this person. And I thought, why was this not listed? Because if I would have found that in the Texas Medical Board directory when I was verifying the license, I would have in no way went to that person. I would have canceled my appointment. I would have.
And you've been so diligent, and that's the thing that's so hard. And let's take a minute and talk about the emotional toll and the family impact. And if you don't mind me bringing up a sensitive subject, you mentioned to me in your correspondence that you have a late sibling who suffered from titanium hypersensitivity.
I have a sibling, and his name is Richard. He passed away at the age of 36. He had spinal hardware that was placed that he was allergic to. And it was an insurance issue involving an auto accident. He could not find help. He was in pain. He developed adhesive arachnoiditis, which is one of the most painful medical conditions a person can have. And he went through nearly 8 years of battling that level. Imagine 8 years of that. He freed himself from the pain in 2019. He's been gone 5 years.
I'm so sorry.
I am too. And there's not a day that goes by, Sherry, that I don't think of him. And He deserved to be here. He's a talented musician, an amazing cook. I miss his food. It's probably why I'm a little bit thinner, probably because his food was amazing. When the chips were down, he was there. He had a lot of struggles in his life, but he had a good heart. And when he was going through all that and our family was going through all that, we had nobody.
Did you know about your own metal allergy at that time?
No, I did not. In our extended family, we didn't have support.
And how did you know he was allergic to the titanium?
Because he had testing done, the ELISA, and it was available at that point because the pandemic hadn't hit. So he had that done, it showed it, and he could not find someone to remove it. He was trying to go be seen in Europe because there are a lot of surgeons in Europe that have more progressive understanding of this from what I've surmised. But he got tired of the pain, and he was in horrible pain. I think of the pain I live in, it's nothing compared to what he went through now that I know what arachnoiditis is. And every day I feel guilt because I think, gosh, he was going through all that. And in my own way, I try to understand it.
Well, but a lot of people don't know this. One of my own journey with connective tissue diseases, which is what this is. It's wonky connective tissue, the lipedema, the EDS, the Tarlov cyst disease, which we're going to talk about Tarlov cyst in an episode eventually, because that surgery will implant a small titanium clip in. But a lot of people with Tarlov cysts have AA or adhesive arachnoiditis. So again, not only do you have this history of metal allergies running in your family, you have a history of connective tissue diseases in your family. And so you just literally have to watch the genetics.
Yes, everything from medications to implants, everything. You won't believe this, even eye drops. The drops they use for dilation, for eye exams. If you have Ehlers-Danlos and you have anything related to cardiac manifestations, like anything, it can cause worsening of dysautonomia and symptoms, the eye drop. So you would think, an eye drop, that's local, right? It can produce systemic effects. So I actually had to cancel an eye appointment and go to someone that would do an exam and look at my retina, do a thorough exam without using the drop. That is how deep this goes. You have to be constantly on alert and making sure that you evaluate anything that's going into your body, food, medications, any procedures, that you do your research, because most people, the average physician, has no understanding of Ehlers-Danlos syndrome, of the comorbidities, of MCAS and POTS. They have no idea. So when you go to them, they have no knowledge of it. And you're basically, you're pretty much a guinea pig. That's what happens if they're not aware.
I'm going to tie this back in the wake of all that you've done and even the recovery you have. Life is still very challenging and very difficult, and they're still trying to modulate your immune system to deal with what the doctor left you with. You talked to me about reaching out to a service in Canada. Pretty heavy topic. Why don't you talk about that?
I want to. And I want to just say that I love life. I love the beauty of life, even with the struggles. I'm a person that I have goals, ambitions. I would consider myself a person of intelligence. I've always liked to seek knowledge, truth. And it got so bad after I had the stents placed and I didn't know what to do. I was so defeated that I considered pursuing medical aid in dying. And it's known in Canada, it's medical euthanasia. And I considered pursuing that because I didn't want to deal with what I was dealing with anymore. And my mom found out about it, and she was very gentle and loving with me about it. She didn't blow up on me. She's not that way. But it has to be bad for me, especially with losing my sibling the way he passed away. It got bad for me to even consider that. I had some close friends that they understood. They weren't happy about it, but they understood why. Because living in chronic intractable pain and having these devices, you don't know what's going to happen. You don't know if you can get things removed. And even the removal procedure of a bypass, it can be life-threatening. I felt pushed into a corner. And I thought, gosh, maybe I should check into going through Made in Canada. Maybe I should consider Switzerland because I know it's legal in Switzerland, right? And I'm thinking, Shannon, you're 46 years old and you're thinking about ending your life in this way, which, of course, some people, if they weren't really thinking, they think, oh, she's suicidal. I don't want to take my own life. I just want this horrible pain to go away. I want it to go away. I don't want to feel this. And you know what pulled me out of this, Sherry? Believe it or not, it was a book I read called The Little Prince. Now, I know it's a children's book, but I read the book, The Little Prince. And something in me, I don't know what it was, but it spoke to me and it changed me. And it's not really a religious book. But it had a wisdom in it. this deep sense of why are we here? What is our purpose? Why do we connect with people? What are we responsible for in our relationships with people? And the rose being a metaphor in the book. And after that, it was just like I started seeing roses everywhere. I started having interactions with these beautiful roses. And we stopped at this rest area on the way back from a medical trip, my mom. And I'm like, Mom, you got to come look at this. And there's this gorgeous red rose.
So new meaning to the phrase, stop and smell the roses.
And all these people were walking by it. I'm like, why are you ignoring this beautiful flower? And I walked up to it. I talked to it. And I'm sure I had some odd looks, but like, I don't care. I'm chronically ill. I have the right to talk to a rose.
You could talk to a darn flower if you want to.
Darn flower. And I just looked at it. I didn't pick it. I took a picture of it. And I just took that moment to think the metaphors of life. You have the roses and then you have the thorns. And these stents, there's thorns right now. My immune system being wonky, they're the thorns. But I still have the rose within. I still have that. And to all the people out there sitting and they have all these issues with devices and they've been wronged and they feel like they don't want to go on anymore. There's still a rose within you. There's a purpose and you can't quit because you could serve as the answer to someone else's prayer or wish. You know, if you quit on yourself and you quit on life, someone else, they've missed the opportunity to know you. And I'm glad I'm talking about this topic because I don't agree with suicide. I don't. But I understand why people get pushed to that point. I think going through this has given me more compassion because before I would have been like, how dare you ever think of that? What a selfish thing. But now it's, no, wait a minute. This person's hurting. They want the pain to end. They don't want to end. Sure. They don't want the flowers to die. They just want the pain to go away. It's a different perspective. I've been studying philosophy because that's helped me. Stoicism, the writings of these great philosophers. Krishnamurti, he was an Indian philosopher. And he said that you have to look at your suffering like a jewel. Now, at first I was like, that's a little weird. But when you look at a jewel, it's this beautiful thing that leaves you in awe. So the people who are suffering, myself included, you, Sherry, we have to look at ourselves in awe. Look at us. We're going through a hell on earth, but we can still smile. We can take in the flowers. We can laugh. We could go for the roasted cashews, right?
For those who don't know, doing that actually reprograms your brain and reprograms your DNA in spite of the pain. It can actually change the DNA and reverse the disease process. It's been shown time and again.
Yes. And Dr. Wayne Dyer, the late Dr. Dyer, he said that when you change the way you look at things, the things you look at begin to change, right? And I'm not saying that thinking differently is going to make the stents disappear. That's not going to happen.
No.
I don't believe in woo. But I'm trying to just hold on to that positive thinking. Let myself cry if I need to. I cried my eyes out last night painting. I'm surprised I didn't wipe out the painting because it was watercolor and I'm crying. And I'm thinking, gosh, I hope I don't, mess up one of the petals or whatever. But I let myself because you have to be present with how you feel. You have to feel what you feel and feel the fear and face the fear. You have to feel the feelings. You can't bury them because that will physically make you feel worse if you just don't allow yourself to feel angry, righteous anger, to feel sad about what's happened to you. That's righteous anger. You have to feel anger. You have to feel these things. They're part of the human experience. And that's what I've learned through this. And before I just put my feelings on the back burner or, I'll just whatever, I'll just paint, which I think it's good to have a creative outlet. But at the same time, I have to face what I feel with this. I can't let it build up and end up blowing up like a nuclear reactor or taking it out on someone that had nothing to do with it. But
and have you chosen to pursue any therapy at all? Any talk therapy?
I'm using an app right now because I'm on a wait list because it's backed up where I live. There's quite a wait list, but I use an app that's AI based and I journal every day with it. I journal. And when I do get in to see this therapist, I'm going to take it with a grain of salt and I'm going to be open-minded. But I use an AI app right now and it helps me. And I log in daily. I do morning and evening reflections. I vent when I want to with it. And it's helped me. It's helped with my anxiety. It's not as bad as it was. So
yeah, wonderful.
Stops. And it's great that it's just on my phone and it's there when I need it. If there isn't a person, well, I pick up my phone, I start venting and it just helps reframe my thoughts. It helps to give me a better perspective on it. And
I've heard about AI companions, but I never really thought of them in the therapeutic modality, but I guess it would still work. Sometimes you just want somebody to listen. It's the old adage of maybe writing out your feelings on paper and then tearing it up or throwing it in the fireplace. Probably very similar.
I have notebooks, and I have a dozen different notebooks. I misplace them, and I get cranky about it. With my phone, I have cloud storage, so it's not going to lose my entries. And then it's not
going to lose your rant.
It's not going to lose it's not going to lose my foaming at the mouth moment. But yeah, I'm just having a little positive stuff. I try to walk every day, and I don't do crazy walking, but just to go up and get the mail, go around the block. I usually run into some neighbors who I'm always happy to see, and they have their cute little dogs with them or whatever. And I played Scrabble with some friends the other night. I'm a Scrabble addict. It's
Rummikub.
You like Rummikub? I played it once and I enjoyed it.
Let's talk about the medical community for a minute. A lot of them blow off metal allergy. Why do you think that is, and what needs to change?
I think it begins with the medical education system. Now, I'm not going to compare it everywhere. I know there's probably issues on a global level, but the medical education system, it begins with how doctors are trained about this. They're trained in a big cookbook, cookie cutter kind of approach. And then also what ties into that is how women get treated by the medical profession. There's a great deal of gaslighting and harm. I know what I went through even prior to my hysterectomy. You know, I'm not trying to change the subject, but it ties into it. What I'm saying. I had undiagnosed adenomyosis for many years, and it's like endometriosis, but it's confined to the uterus. It causes excruciating pain. It's horrible. And I went to all these doctors. They were prescribing birth control pills and ibuprofen, blowing me off. I finally found a surgeon that was compassionate, listened, had my imaging reviewed, and it was adenomyosis. And I had also intractable PMDDs. So I had a hysterectomy in January of 2022. And I'm glad that I did. It was a lot to go through, but actually of all the surgeries I've had, that one was probably the easiest. It really was, because it was robotic. It was outpatient, which is a little bit wild.
I've had that surgery.
You had to,
no metal, at least not in mine.
In my surgery, I will say now, the surgeon that did mine, she said, I won't put one clip in you, and we'll do it that way. I'll use cautery, but there'll be no clips, no foreign bodies. And she did value my input, and she listened to my needs. So I will give credit. She was a wonderful surgeon, and we still stay in touch. I love her. But at least I had one positive experience. But let me tell you, Sherry, it's the gaslighting. It's the medical education system, especially here in the United States. Now, I don't know how it is in other places, but the metal allergy, they're just slowly learning about this. And most doctors, they don't believe in it, or they think it's rare, which it is rare. Up to 20% of the adult population is allergic to nickel.
It's not rare. It's underreported. 1 to 3 out of every 100 are systemically allergic, and that is clinically significant. What role do you think informed consent should play in medical procedures?
I think that patients should have more say. There should be more communication and dictation of what the patient is saying and expressing before they have these procedures. If there is a metal allergy, it needs to be stringently documented. I feel there needs to be mandatory testing, and that goes back to your petition. I did sign that. There needs to be mandatory metal allergy testing and accountability and transparency before these procedures, because once they're placed, it would be easier to know ahead of time than to be in a situation like I am or other people. Oh, great, they have all this hardware in them. That's not a minimally invasive, easy procedure. And every time you have surgery, that's a risk of anesthesia and infection and everything else. So there needs to be more accountability. Informed consent, there needs to be more education about that in general. Because a lot of people think, oh, informed consent, that's part of clinical trials. They don't think beyond what it really means. And there be more patient education, well, especially more medical education about metal allergies, about rare illness.
If we're going to put a clip or staple in somebody, it needs to be spelled out more than just standard of care.
Yes, and it needs to be also documented. A lot of people have these devices in them, and they're not given any identification of what was placed, what the material is. They find out when they have an x-ray, oh, there's clips noted by the radiologist, and people are like, well, what's this, right? There needs to be documentation of the implants. When I had my fusion, I wasn't given a card. I had to reach out to the manufacturer, and they provided me a card to fill out. That's not acceptable. It's
Right.
not. And of course, if you go through an airport and you get screened and they see stents, they look like cables on a person.
And it's really important to point out, because I get comments about this on social media, not all metals are unsafe for airports and MRIs, etc. A lot of the surgical grade titanium and hardware that's used is ferromagnetic, which means it's safe for MRI and X-ray machines. So we're not necessarily going down that road that all metal is a problem and you need an implant card for all metal, because you don't. But it would be really nice to know ahead of surgery, if we have to put this surgical clip in during your colonoscopy, if you've got a bleeding polyp, we have to put a clip in. Have you ever had any metal allergies? Okay. If we have to put a clip in, here's the name, make, model, manufacturer. We'll make sure to write that in your discharge paper. So if you have any problems after, come back to us. You develop any weird symptoms in the next 4 to 8 weeks, come back to us. We'll give you a diet you could follow. You could try some antihistamines and we'll start seeing if this could be a potential problem. Or, oh, hey, if we're going to need that and you do have a metal allergy, guess what? We can switch to a ceramic or a plastic clip. Now, I'm not advocating for any foreign bodies. But these are the discussions we're not having.
Giving the option of different materials for patients too. Yes. Because if they're only using one, let's say titanium, and the patient's allergic, there needs to be multiple options given of stainless steel, of ceramic, of even a hard plastic material, if the patient's compatible, right?
I get all the comments that, oh, colonoscopies, we don't ever use a clip. Yes, they do use a clip if your polyp is bleeding, and usually that clip will be sloughed off by the body, but guess what? It's not always. And then it can embed in the intestinal wall. It can migrate. It can create all kinds of trouble. Now, that's not to scare people away from colonoscopies. Go get your colonoscopy. But doctors, let's have these discussions and know that these things can happen. It's rare. They don't always happen, but it's not zero.
It's very surprising, the surgeries that utilize these clips. Like, people think, oh, I had a minimally invasive procedure. Those laparoscopic ones tend to use a lot of clips. When my gallbladder was removed, that surgeon used 11 clips and most used 2 to 4. So I had most of them removed. There's still 2 left, but I had clips removed from that gallbladder surgery that I had in 2006. They don't tell people how many they're going to use. I was never given a device card. I don't know what they were made of, but all I know is I was having a lot of IBS symptoms. So there's a good likelihood there was titanium present, because most of the surgical clips used these days here in the US are titanium based. Mm-hmm. So it's it's unreal.
If you could address doctors and medical professionals directly, what would you say to them about the importance of listening to patients with known allergies to metal?
I would say this. You as a doctor, you went to medical school. You were chosen as an applicant out of a group of thousands of applicants. You were chosen with a small number. You were selected and given the privilege of becoming a doctor. This is something that you might have prayed for as a young person, dreamt of, that your family wished for you, that your family pulled their resources together for, so that you could fulfill your dream. And part of that dream, part of being a doctor, is taking that Hippocratic oath to first do no harm. And that would involve listening to patients, taking things seriously. If you're going to use a device as part of your care for a patient, that you understand what it is, what it's made of, the complications. If you have a patient come to you and you say, doctor, you perform this procedure, I don't feel right, you're going to value them as an individual and take them seriously. You're not just going to look at textbooks. You're going to play your role in the humanity of medicine, the soul of medicine, right? And I'm not pushing religion. I'm just saying that, doctor, when you got accepted in medical school, that moment you found out, that joy you felt, that joy and hope. There are patients that have joy and hope like that, and it gets crushed when something is done to them, when they're ignored, when they're dismissed, when they have their heart broken, they put trust in a doctor, and they have the rug pulled. And so please, doctor, listen to your heart, listen to your patients. Don't ignore them. Don't gaslight them, because you might be the only one in their life that can help them and give them that hope to restore their healing. So that's what I have to say. But I do thank the good doctors out there that listen. I thank them, the ones that might not know it all, but they're willing to learn. I thank them. And I thank the good doctors I've had that have helped me, that have listened to me and value me. I thank them, and I acknowledge them as well. So that's what I have to say, Sherry.
Wonderful. So tell me what your hopes are for the next steps in your treatment.
My hopes to find something to modulate my immune system, and or find someone willing to help me remove these stents in the most minimally invasive, effective way, and to keep sharing my story. And I'm going to keep persisting. And I'm going to be patient, because there's a saying that patience will turn slaves into kings, but impatient desire will turn kings into slaves. So we must be patient. We have to be patient even when you don't want to be. But I'm going to keep being patient and persistent. And that's what I ask of everyone that's going through these medical ordeals. Try to be patient. It's hard when you feel horrible, but you have that rose within you. You're meant to bloom. You have that light within you. It's there. You might not be able to see it right now in the darkness, but there's a light. There's still a light. You just have to look and believe.
I was going to ask you what message you'd like to leave our listeners with, especially those who are struggling with similar medical issues. Is there anything you want to add to what you just said?
I would like to share a little poem that I wrote. And I like to write poetry. It's one of my favorite things. And it's for all of you that are in darkness right now. You're in darkness in a medical ordeal, and you can't see through. You can't see the light at the end of the tunnel. You can't see it. But this is a poem I wrote called I Can See the Light, and it's for all of you. I can see the light, even though it's tiny specks, glittering through the cracks, behind the walls of pain. It was entrapped, cloaked by uncertainty, but the light was always there. I need no cosmic ray of force or flood of luminance for it to prove itself. The glimmers make its case. The casting of tall shadows prove it never died. I can see the light. And to all of you out there, you can see the light too, because it's within you and it pours from you. And when you show compassion and you acknowledge compassion shown from others, that keeps that light going, that torch of hope when it feels hopeless. The great teacher Rumi said that to know that pain will be your cure, the wound is the place where the light enters the person. We have to cling to that light, and it still exists. It's there. And I send my love to any person out there who's crying more tears of pain than joy. I want you to laugh. Watch something that makes you laugh. Watch something goofy. Act goofy. Make someone else laugh. Try to. Yeah. I'm goofy all the time with the brain fog. Just anything that can make you feel better. Cling to anything that makes you glad to be alive, whether it's art, your favorite soup, just something that makes you glad to be here. Roasted cashews in moderation. My mint cocoa. Oh, I love it. And then during the holidays, I've been getting quite a bit of it from neighbors. I got to be careful. But anything that makes you glad to be here. There's always a reason to be grateful and to stay here. So stay here and keep persisting, and don't stop believing that there's an answer.
And you have a community here. Thank you so much, Shannon, for sharing your story with us. Your courage and advocacy and passion are just really incredibly inspiring. And I hope your journey brings about much needed change for you in how the medical community approaches metal implants and allergies for all of us. There's a lot of information in our show notes about things that Shannon and I may have discussed today, so always go there. There's petitions to encourage medical providers and facilities to pre-screen patients for metal hypersensitivity, and there's a whole page of resources at heavilymetaled.com. I will remind you to like, share, and subscribe. Every comment, every thumbs up, every time you share gets us out in front of the algorithm and helps our page to grow, because there are a lot of people suffering out there, and Shannon and I desperately want to reach those people who think that they're at the end of their rope. So to all our listeners, thank you. And thank you, Shannon, for being part of the movement, joining with me to tell the medical establishment that we're not going to take it anymore.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetaled.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.